Hi, my name is Patricia. I'm a registered nurse and a Medicare agent. In this video, I am going to show you how to get extra benefits if you have Medicare and you are low income. So we're going to use this strategy by you applying for Medicaid. When you apply for Medicaid and you have Medicare, you get extra benefits. You can get your Part B premium paid for. And like I said, you can get extra things like a monthly grocery card. So if you want to know how, keep watching this video. So if you are low income and you have Medicare, you can also apply for Medicaid, okay? So why should you apply for Medicaid? Well, there are 4 different levels of Medicaid. Depending on the level, you will have your Part B premium paid for, and you can have your deductibles paid for, your co-insurance and co-payments. And we will go over the 4 levels of Medicaid, okay? So who's eligible for Medicare? So if you're 65 and older, worked in the U.S. for 10 years, you have end-stage renal disease, on dialysis, or had a transplant, you have Lou Gehrig's disease, also known as ALS, or if you were disabled for 24 months, the 25th month you would get Medicare, okay? So like I said, if you have Medicare, you should apply for Medicaid if you are low income, okay? And we talked about why you should apply for Medicaid. So there is an income requirement and an asset requirement, okay? Depending on what level you're going to get, depending on your income and assets. Alaska and Hawaii income requirements are a bit higher, okay? So who can apply for Medicaid? So if you are a caretaker of children, if you are a child, if you are a pregnant woman, if you are in the foster care system or a foster care individual, if you're 65 and older, so that's why I'm recommending that you apply for Medicare and Medicaid, 65 and older, if you are disabled and not receiving SSI. Those are the individuals that can apply for Medicaid. Now, there is an income and asset requirement as well. These are the 4 levels of the Medicare Savings Program. QMB stands for Qualified Medicare Beneficiary. SLMB stands for Specified Low Income Beneficiary. QI stands for Qualifying Individual. QDWI stands for Qualified Disabled and Working Individuals. So these 4 levels will determine what the Medicare Savings Program will help you pay for. Now with these 4 levels, there are plus, as you guys can see. So you have the QMB plus and you have the SLMB plus. So the plus means that this individual also have QMB plus full Medicaid, okay? Same thing with the SLMB. It means that they have SLMB plus the full Medicaid. Depending on the state, it depends on how much assistance that you would get. Okay, let's talk about the 4 Medicare saving programs. Let's start with QMB. So QMB, the individual monthly income limit is $1,153. For a married couple, the income limit is $1,546. So these limits are slightly higher in Alaska and Hawaii. So your individual resource limit is $8,400, which is your assets. And for a married couple, the resource limit is $12,600, which is your assets, okay? So with QMB, the program helps pay for your Part A premiums, your Part B premiums, your deductibles, your co-insurance, and your co-payments for services and items that Medicare covers. So say you end up in the hospital, say you have a Medicare Advantage plan, and say your inpatient hospital stay is, let's say, $200 a day. Well, if you have Medicaid and you have QMB, guess what? Medicaid will pay for all of that. Okay, so it'll pay for your in-hospital stays, it'll pay for your deductibles, co-insurance, and co-payments. Everything would be paid for. So if you do have QMB, this is the most important part of this video, so please pay attention. Medicare providers aren't allowed to bill you for services and items that Medicare covers, including deductibles, co-insurance, and co-payments, except for outpatient drugs. Pharmacists may charge up to a limited amount, no more than $4 in 2021, for prescription drugs covered by Medicare Part D. So if you get a bill, I want you to take that bill, write QMB on it, send it back to whoever sent you that bill, because you're not responsible to make a payment if Medicare covers those services, okay? So write QMB on it, send it back to them, and you want to let your providers know that you have both Medicare and Medicaid, so show them both of your cards, because they're not allowed to charge you for those services that Medicare covers. For SLMB, so for SLMB, individuals' monthly income limit is $1,379. For a married couple, your income limit is $1,851. So with your SLMB, this will pay your Part B premiums. So if your Part B is $170.10, then you would not have to pay that if you have SLMB. So we talked about QMB and we talked about SLMB, where there's a QMB plus and a SLMB plus. So if you have QMB plus, this refers to someone that has full Medicaid benefits and they will have their cost sharing covered. And we talked about that, which is your deductibles, your co-insurance, and your co-payments paid for, okay? Now the SLMB plus, these are individuals that their Part B premiums are paid for, plus they have full Medicaid benefits. They get protection for the cost sharing depending on the state. So various states help with the cost sharing as well, which is the deductibles, the co-payments, and the co-insurance, but it depends on the state if you have SLMB plus. Also, those that have QMB, QMB plus, SLMB, SLMB plus, and QI. We'll talk about QI in the next slide. All of these get help with extra help for prescription drugs. So you are automatically eligible for extra help for your prescription drugs. All right, so now let's talk about QI, which is the qualifying individual. So individual monthly income limit is $1,549, and the married couple monthly income limit is $2,080. The QI individual resource limit, which is assets, is $8,400 for an individual and $12,600 for a married couple. The Qdwi program helps pay for your Part B premium as well. So like I said, if your Part B is $170.10 in 2022, then you are not responsible for your Part B premiums. So now we're going to go over the Qdwi program. So this is the qualified disabled and working individual. So the individual monthly income limit is $4,615. For the married couple, it's $6,189. Now, do not forget that the income requirements are slightly higher for Alaska and Hawaii on all of these 4 programs, okay? Now for the individual resource limit, it is $4,000. For the married couple, resource limit is $6,000. For QDWI, you are not responsible for Part A premiums. So for QDWI, your Part B is not paid for, okay? So only for Part A. So if you have Medicare and you decided to apply for Medicaid, there are special needs plans for individuals that have Medicare and Medicaid, and these special needs plans are a Medicare Advantage Plans. The Medicaid will pay for the premium for this special needs plan, so you're not paying anything extra for it. You do get extra benefits. Some of these plans may have an extra benefit like a monthly grocery card. Now, if you do need assistance to apply for Medicaid and you live in Florida, my office can assist you with that because our office is located in Florida. Now, with other states, if you needed assistance to get on the dual plan, we can assist with that as well. Please do take note that not all states have these dual plans, but either way, you can still apply for Medicaid in your state. Thank you so much for watching this video. If you need assistance, you are more than happy to give me a call. My services are 100% free, and I'll see you on the next video. Please share this video with a friend. See you next time.